Hello parents, my Dr. Amit. I am consultant pediatrician and neonatologist at Navi Mumbai. So आज मैं आपको ऑन द ईव ऑफ वर्ल्ड अस्थमा डे आज मैं आपको अस्थमा के बारे में थोड़ा बहुत इन्फॉर्मेशन देना चाहता हूँ. So what are the symptoms of asthma? So the most common symptom is breathlessness which can be due to persistent cough which can get triggered by viral infection, can be due to pollution, due to dust or dust mites. The second most common symptom is chest tightness. The third most common is wheezing sounds, the continuous sounds from the chest, which is mainly during the expiration or the inspiration also. The fourth one is like you can feel about breathless breathing problems like shortness of breath, like rapid breathing or gasping for air. So these are the most common symptoms which we can experience during an acute asthmatic attack. So what are the most common allergens what are the most common triggers which can trigger this acute asthmatic attack or the chronic asthma? So the most common is pollution followed by dust mite, smoke or a viral infection. These are all common triggers for the acute asthma. So what are the options available to diagnose that your kid is having asthma? So the most common is peak flow meter. The second most what we measured is about the spirometry, and the third most commonly is forced oscillation technique. These are the treatment. These are the investigation which available to diagnose as asthma. So how we can avoid these allergens? The most commonly you can do that. We should be educated about the trigger. We should know the triggers for this attack. So the education is most important for parents and the near and dear ones. The second thing is we should avoid all moisture prone areas. We should encase our beds and pillows with their covers. We should remove the affected furniture from the room. We should keep pets away from the patient. We should keep pets away from the bedroom. And the last thing is just you should avoid pollution. You should not be get more involved in any construction things, and we should be away from the pollution. So, what are the benefit medications? First of all, inhaled medications, quick in actions. Their targeted delivery with less side effects or no side effects. Plus, you will get better symptom control as compared with the oral medication. So, it is always preferable to have inhaled medication to relieve and control the asthma symptoms. So, the device which we use to give inhaled medications, it depends on the age group. If it is the child is less than 4 years, then we start with the inhaler, spacer and mask. If the child is more than 4 years, then we give inhaler and spacer. If the child is more than 8 to 10 years, then we give only MDI. And along with that, there are new delivery devices also, breath accentuation device, or you can continue with the dry powder DPI, dry powder inhalers that also can be used. So meter dose inhaler is a device which gives fixed amount of drug in the form of spray. So MDI comes with the spacer. The spacer is attached with the MDI which can be held by the child and through which child can breathe very easily. There is another device called as nebulizer which convert that a liquid medicine into fumes. So but it is better to give nebulization with oxygen always during an acute asthmatic attack. So we advise to give nebulization at hospitals only. So some FAQs on asthma. First of all, the most common FAQ is whether it is a contagious disease. No, it is not a contagious disease. It is genetic, it runs in families, but it is not a contagious disease. The second most common is whether there are any side effects of using steroids for long duration. So parents, the dose which we are prescribing and giving to kid during the attack or during as a controller therapy is very low dose and which don't cause any side effect. Third most common FAQ is how can we prevent this acute asthmatic attack? So parents, the first thing you have to monitor that your child is taking the prescribed controller medication properly, routinely. Second thing, you should be avoiding all the triggers. Avoiding contact with dust, pollution are the known trigger for your asthmatic attack. The third thing is you should have written asthma action plan. What are the symptoms? What are the dose medication which we are giving? The fourth one is like you should have regular asthma checkups. Regular asthma checkup every 3 monthly, 6 monthly, so that the technique of inhalation, technique of inhaler medication can be checked by the doctor. There will be adjustment in drug and dosages. So we should have a regular frequent checkup for acute asthma. Most common FAQ parents ask during the OPD visits: can asthma be cured? Asthma, if we detect early and managed properly, then asthma can be well controlled. So, parents, now you are aware of what is asthma, what are the causes, what are the triggers for asthma, what are the symptoms of asthma, what are the treatment modalities of asthma. So, we should do we should make aware of all the near one and dear one about the asthma, what are the treatment modalities available, and let the child or a parent or a human being who is suffering from the asthma breathe freely. Thank you.